I now give the call to the honourable member for Longman.
Thank you, Mr Deputy Speaker. Last Wednesday, on the 29th of June, it was my honour and pleasure to officially open the Murri Teilah Medical Centre in Caboolture. It was fantastic to be there and to share in the excitement of the local Indigenous elders, medical professionals and about 300 Indigenous members of my community. And I would of course like to take this opportunity to recognise Ken Wyatt, my friend and colleague, a strong advocate for better health services and someone who has developed his own relationships with local Indigenous elders, including Auntie Lynn Matson. Mr Deputy Speaker, there are several exciting aspects of this centre. The first is that it is specifically designed to provide culturally sensitive medical care to Indigenous people in our community. It is sadly the case that some Indigenous people are reluctant to access mainstream health care for any number of reasons. This can sometimes result in conditions that could be managed or, better yet, prevented, if caught early enough, turning into chronic conditions. Mr Deputy Speaker, it is my understanding that initially the centre will focus on providing services to those who, for whatever reason, are unable to attend regular services. While this is the focus of the centre, its doors are open to the whole community. One of the features of the service that Murri Teilah Medical will provide is a patient transport service that will make access to the centre so much easier for some members of my community. The centre will provide women health services, include a clinic for mothers and babies, an immunisation clinic, chronic disease management and prisoner release care. Importantly, it will also cater for allied health referrals such as oral health. Mr Deputy Speaker, there are approximately 5,000 Indigenous people in the Moreton Bay region, and until now there has been no dedicated medical centre to cater for their needs. The idea for the establishment of the Murri Teilah Medical Centre came about through the vision and energy of the founding directors of the centre, Jenny Anderson and Anita Kemp. They believed in the development of a medical centre that would cater for the needs of the Indigenous community in the Moreton Bay area that was not dependent on government. Their energy and dedication has seen that vision come to fruition. This medical centre represents a vibrant and active community seeking to find solutions to very real problems and, in the process, owning its own destiny. Mr Deputy Speaker, the second exciting aspect of the Murri Teilah Medical Centre model for healthcare is that it is privately funded. A need was identified in the community, and the community went through about finding ways to meet that need. As soon as an Indigenous community in the region became aware of the idea of the centre and the services proposed, they worked tirelessly through fundraising efforts and volunteering. This is about the community delivering a real result, Mr Deputy Speaker. Mr Deputy Speaker, this is a fantastic example of how a community can identify and deliver service required for that community without the solution being imposed by the government. If the community wants it and the community delivers it, the outcome are probably going to be good, and we have high hopes for Murri Teilah. The centre expects to have some 1,500 financial members comprising donors from the private sector and private citizens and Indigenous community groups. The centre bulk bills, so cash flow will be generated through Medicare rebates. Mr Deputy Speaker, it is my understanding that Murri Health Group has developed partnerships with Queensland University of Technology and is looking to partner with Queensland Health to further enhance and provide care programs for older Indigenous people and for mothers and babies. Intervening early through regular health checks and immunisation programs will undoubtedly improve health outcomes for Indigenous people in my community. Mr Deputy Speaker, I share the excitement of the board of the management of Murri Teilah Medical Centre. It is exciting for my community that there is now a place where Indigenous people can come to receive culturally sensitive care. I would like to take this opportunity to congratulate Jenny Anderson and Anita Kemp, the elders and everyone that has contributed to the establishment of this important new facility in our community.